you know, Tony, if I put this on my lapel, it will work? Okay. Good. Well, I'm thrilled to see all of you here. When I was thinking about a really lovely Wednesday night, I was thinking, well, you know, maybe we'll get 20 people, 30 people. So it's really a joy to me that you're all here to listen in, learn about, and take action when it comes to the health care bill that's waiting in Congress. I just want to start by saying that we, you and I, are the keepers of liberty. We cannot depend on our legislators, our members of Congress, and least of all, the government, to protect our rights and our liberties under the United States Constitution. And here in Minnesota, we also have a state constitution. So it's really about you and me protecting what happens to us. And every day you decide to accept or reject the latest plan, the latest bill to take away another piece of your freedom. And every day you decide whether or not you'll stand up or bow down to those who say that they, not you, know what's best for you. You are not who Keith Olbermann, host of MSNBC's Countdown program, says you are. On Monday, he claimed vociferously that you are fearful, suggestible, and easily led. You are the vast, unthinking throng. You are spoiling for a fight, waiting for an excuse, looking for a rationalization of your own unwillingness to accept democracy. These are his words. They're online. He said that mercenaries and instigators, his terms, like Glenn Beck and others, Sarah Palin, for instance, enjoy bending the masses to their will and adding to the imagined revolution whose fires have been stoked for weeks, for months, for years by conservatives. End quote. Well, it was an amazing rant, and you can find it online. Everything he said about you is there. But that's not really you, and that's why you're here, and that's why people like you are appearing everywhere in town hall meetings all across the country. Now, let's look at this health care reform bill. Well, I'll wait for that just a minute. Okay. This year's debate is so different from 1993, for those of you who remember that debate, when Hillary introduced her grand scheme to take over health care. That was before Twitter, Facebook, YouTube, websites, IM, video-ready cell phones, and the advent of everyone being wired almost 24/7. Back then, we had to count on Harry and Louise commercials from insurance companies, a compelling and convoluted chart out of Majority Leader Dick Armey's office, and a constant stream of warnings out of the Wall Street Journal. Back then, health insurers, the American Medical Association, and large employers opposed the Hillary plan. Now, they're all cooperating, along with the AARP, to help President Obama enact national health care and freedom, eviscerate the Constitution, and bring socialism to America's shores. Well, thank God for you, because you are making all the difference in this debate. Together, we need to win this battle not only to stop this bill, H.R. 3200, the Affordable Health Choices Act, but to take back the many freedoms we've lost as employer-sponsored coverage, Medicare, the HMO Act of 1973, HIPAA's intrusions and evisceration of privacy, and kid care have taken us ever closer to socialized medicine. Now comes the Obama administration's health care deform bill, a 1,018-page bill meant to put government fully in charge of health care, with health plans denying care as government contractors on behalf of the government. Well, here is the bill. But this is only half the original bill. They shrunk it down to 504 pages. And I've pondered why that might be. In other words, it's still all the worse, right? But they shrunk it into half size. And I'm thinking that perhaps what happened is that members of Congress and their staff are actually reading the bill and no one wanted to download 1,000 pages. So could they please shrink it? Or perhaps you're all reading the bill and the complaints are coming in. Or perhaps they were hoping that those who had page numbers of the bill to lead you to where they were now have left you in the lurch. But thank goodness for Liberty Counsel, who actually put section numbers and all of the things that they said about the bill, so that you can simply go into the bill and look for the section. And somewhere here I have Liberty Counsel's piece, but I seem to have forgotten it. Anyway, I brought it with, and you just have to look up libertycounsel.org or lc.org, and you will find it, so you can look through the entire bill yourself. Anyway, let's look at what's in the bill for those of you who would prefer to hear it, at least a small piece of it. So here's just 20 items. You know what's in this huge bill. Well, when it comes to benefits, health plans can limit access as long as the limit is related to clinical appropriateness. In other words, it's a very convoluted piece of language that they have in there, but what they're really saying is go ahead, ration care as long as you can say that it's clinically inappropriate. Then a health benefit advisory committee made up of political appointees, and I believe only one doctor, will decide what kind of benefits are and are not essential in the essential benefits plan, and the Secretary of HHS will be authorized to make it so by rule. And if you get our email, or if you happen to know what the Federal Register is and you check there every week, you will be given the notice of being able to comment on what these essential benefits are. If you don't, you're not likely to hear what's happening. There will be a new Health Choices Commissioner, which will rule over insurance choices. He or she will dictate what's in and what's out. And one reporter asked me about this Health Choices Administration, and I said, well, it's a little bit like the, and of course now it's, because I didn't put this in my notes, it's a little bit like in 1984 where they had, I think it was called the Love Agency, where there really wasn't a lot of love at all. Well, just like there wasn't a lot of love, there's not going to be a lot of choices in the Health Choices Administration. Number 4, there's an anti-discrimination section which appears to allow the provision of medical treatment for non-U.S. citizens. Number 5, there's an electronic data system that will be set up, it appears, to access your bank accounts for what is called real-time adjudication of claims. And it will be used to determine whether, and I'm going to quote here, whether the individual is eligible for a specific service with a specific physician at a specific facility. End quote. This system may include utilization of a machine-readable health plan beneficiary identification card. And in short, what we call that is a national patient ID card, something that has the health department, U.S. Department of Health and Human Services has been thwarted since HIPAA went into place in 1996. They have, the law says that they can create for all of us, issue all of us a national patient ID card under which all of our treatment decisions, our health status, and everything else can be tracked. They don't say health ID card in here, but I say that that's what that is. Number 6, all Medicaid eligible individuals will be automatically enrolled in Medicaid. Doesn't matter if you don't want to be, doesn't matter if you decide to pay on your own, doesn't matter. You will be on the dole. Number 7, physicians will be coerced into participation because as long as they remain Medicare providers, they'll be eligible to receive higher payments for any patient they see in the Medicare for All public option plan. Number 8, employers will be required to automatically enroll individuals into health insurance unless the individual affirmatively opts out, which means you have to sign a paper or they get to put you in a plan of their choice. Employers who refuse to offer insurance, on the other hand, will be taxed 2 to 8% of their entire payroll. The money will go into the new Health Insurance Exchange Trust Fund at the new Health Choices Administration. Number 9, there'll be a tax on people who don't have acceptable coverage. People who don't buy or have government-approved health insurance, no matter if you want a different kind of plan, no matter if health savings accounts aren't considered acceptable, you will be taxed for 2.5% of your income. Unless you're a non-resident alien, or you can somehow find a religious exemption. Number 10, doctors seeing Medicaid patients will be all paid the same regardless of specialty. The Secretary will determine the value of their time, mental effort, and professional judgment, technical skill, and physical effort, and stress due to risk involved with each service given.